Hi everyone, I'm making this video to help you answer some of the frequently asked questions related to ADAT. So the aim of this video is to share with you some answers that I was able to find when I had few doubts before sitting for this exam. So my very first question was, what is a good score to aim for when I am sitting for ADAT? So the answer is, if you're planning to apply to any Canadian school, your aim now should be as high as possible. Any score which is above 600 definitely makes you stand out, but now it is highly competitive, and that is why I say that you should strive for the best and the maximum score. But having said that, there have been admissions in the previous years with candidates who have had their scores around 580, but they performed exceptionally well either in their interviews or if the university asked for bench tests. So most of you must have had a look at these graphs, which ADA gives along with the scores of the people who appear for this examination. It gives you the idea about the previous year scores. And as you can see, once you cross that mark of 600, there are very high chances for you to stand out because about 90% of the people are able to get around 550. But it is only 10% who are above that score, above the score of 600. So it is a very good, like, it gives you a very good edge over the other candidates if you're in that window. I would also like to mention here that your ADAT score is something that you can control and aim to get the best score. But along with that, for the schools that you aim for, you need to have a very good GPA, and your some schools ask for a very strong CB. And apart from both of these things, you need to sit for the interviews in all of the school admissions. So you need to have very good soft skills. Some schools are asking for the simple interviews, some are asking for Casper, some are asking for MMI. So at this time, these are the schools that are requiring ADAT for their admissions. Currently, McGill, U of T, University of Saskatchewan, and from 2025, University of Manitoba and Alberta. Now, I have had many people ask me this question: that is it okay to take a course, and if yes, what course should I take? Honestly, I prepared for this exam on my own, but before sitting for this exam, I did appear for AFK and ACJ, and I believe that was a strong backup because it does require a lot of thorough study. It's a very detailed and very comprehensive exam. So I would say that this is a very subjective question, and the answer is different for different people. You need to see in which process of equivalency you are at, because this will help you know which areas you need to work more for this exam. As you all know, that ADAT tests you for the basic sciences, the clinical sciences, and the evidence-based dentistry. So if you've appeared for the AFK, your clinical aspect is mostly covered. If you have appeared for INDBE, your basics and clinicals will mostly be covered. And if you have appeared for ACJ, then your clinical judgment also gets strong because ADAT now has started asking questions on clinical judgment as well. So the different sources of preparation are available. You can do self preparation, very much possible and feasible. You can take some subscriptions. These subscriptions are helpful in a way that they will tell you what kind of questions are expected, and they do have a lot of material in their descriptions for the answers that definitely helps you in the exam. Now, there are some crash courses available for this exam. Yeah, you can take one of those courses if you have not appeared for AFK or ACJ. So let's talk about the different subjects individually. Talking about the clinical aspect of this exam, so it covers all the theory and the clinical judgment. The exam expects you to thoroughly revise the basics of all the clinical subjects and clinical judgment. Some of the very important topics which I think you should be thorough with. I've tried to mention them here, but it's not limited to these topics. So, it's most importantly, you need to be very thorough with the periodontal disease classification and different types of flap procedures. The endodontic diagnosis, surely a couple of questions are expected. Emergency situations, your diagnosis and management should be very thorough and clear. In orthodontics, they have started asking questions based on diagnosis, based on photographs, and they want you to know all the simple appliances and the concepts behind them. You need to be thorough with local anesthesia, the pharmacology, and the techniques. In prosthodontics, they've started asking a lot of questions on the newer techniques like the CAD CAM, the rapid prototyping. They also ask the basic questions from complete dentures and removable partial dentures. And in the materials, they've started asking a lot of questions about all ceramics. Also, for periodontics, they want you to know all the details about the bulk therapies. They want you to know chronology of tooth eruption. They want you to identify oral pathology as well as normal conditions that are commonly seen in oral cavity, which can be mistaken as pathologies. Materials other than all ceramics and prosthetic materials, they want you to know composites thoroughly, especially all the concepts related to the hybrid layer, elastomers, and alloys. You need to have a complete and thorough knowledge of all the ethical principles, and you need to do it in a very detailed way. Now let's talk about the biomedical sciences. As we all know that this topic is so vast, but the exam does not expect you to know everything in biomedical sciences, but they want you to know all the relevant topics related to dentistry. And very importantly, they want you to know the physiology of different systems. They want you to know the basic biochemical pathways. They want you to know the general pathology, the pharmacology related to dentistry, most importantly, some infectious diseases, which are very important for us to know, like HIV, hepatitis, the serology, the tuberculosis. They want us to be thorough with the sterilization procedures. I felt that a lot of questions were related to histology, so I would suggest if you can do a detailed study of general histology and the one that is related to dentistry, the oral histology. Along with this, when you talk about anatomy, most of the questions, in fact, the only questions from anatomy were from head and neck. So I think if you do that, that should be good enough. Occlusal histology and anatomy should be revised in the most detailed way. Occlusal anatomy is not a very vast topic, so you try to do it like all the possible details because that can help you fetch a good score. So when I sat for this exam, the evidence-based dentistry was limited to some of the questions that are available in a like online subscription. But trust me, the questions were not limited to the biostatistic aspect of it, where you need to do the calculations, you need to know the study designs. But it was a lot of application-based, evidence-based dentistry that was asked in the exam. I would suggest if you could spend some time on this. I would also try my best to bring out another video which will mainly focus on the biostatistics and the evidence based dentistry. But I would like to mention some important concepts here that you should cover before the exam. You should know thoroughly all the type of study designs and the biases related to them, the relevance and the clinical significance of evidence based dentistry in our clinical practice. You should have thorough knowledge of the biases, as I said, a clear understanding of different concepts and calculations like odds ratio, relative risk, attributable risk, frequency distribution curve, mean, median, mode. All those things, these calculations should not just merely be crammed. The concepts behind them should be understood thoroughly because the question will test your knowledge and not just ask you to do some calculations. You should know the different types of errors that are possible when we do the research, the level of significance, the concept of sensitivity, specificity, how the clinical and the statistical significance is related, because they will ask you questions related to, like, if you come across a case report, will you believe that? Or if you come across a case studies with just 3 to 4 cases covered, are you going to believe those test results and all that? So you need to have those concepts, the concept about pico, and also the levels of evidence, like which amongst the following has the highest level of evidence. So let's just talk about some important tips that can help you again for this exam. Again, I'm sharing my point of view. I would like to say that do not give this exam if you're not fully prepared. You do not need to know everything, but you need to be smart enough in your preparation, and you should know something that will make you stand out from the rest of the candidates. So you need to individualize your need of what preparation will best suit your situation, as if you're good enough to do the self preparation, or you need a course, or you need just the online subscriptions. You need to individualize your needs according to your preparation. Try your best in the very first attempt. So, as I said, once you have your ADAT score, this is one factor which you can control when you apply to any dental schools, because there are many other factors that are involved. It's a very comprehensive exam and it needs a very smart preparation. I would like to mention in the end that all I'm trying to do is help all of you who are appearing for this exam by answering some of the questions which I didn't have answers to when I sat for this exam. And I'll try my best to bring out some more details that will help you guys. I want to wish you all the best. Stay positive. Take care.